So you're thinking about cosmetic surgery, and let's be honest, trying to find the right surgeon can feel pretty overwhelming, especially when your safety is on the line. In this explainer, we're going to cut right through all that marketing noise and give you a clear step-by-step guide to finding a truly qualified provider in Scotland. Okay, let's kick things off with a fact that might genuinely shock you. The title plastic surgeon, it's not legally protected in the UK. That means, as you see here, any doctor can call themselves that. This is the single most important reason you need to know exactly what to look for. So that's the big question, isn't it? In a world where titles can be so misleading, how do you find someone who is actually truly qualified? Well, we're going to answer that by first breaking down the 3 types of clinics you'll find, and then we'll give you a simple 8-point checklist to verify their quality. Alright, first things first, we've all done it, right? You hop on Google and type in best cosmetic clinic in Scotland. But are those top results really the best? Or are they just the best at marketing? Let's pull that idea apart, and here's the catch. There's no official ranking system. So when you see those best of lists, you're not looking at a list based on clinical quality. You're often just looking at who has the biggest marketing budget. It's basically paid advertising. So this really means we need to change our whole mindset. It's not about finding the best clinic, it's about finding the right expert for you. You know, the surgeon who's a genius at rhinoplasty might not be the specialist you need for breast surgery. It's all about finding the perfect fit for your specific goals. Okay, so to find that perfect fit, you got to know who the players are. In Scotland, you're basically going to run into 3 types of providers, and believe me, their business models can completely change your experience. Now, this table is super helpful because it lays out some really key differences, but I want you to focus on one line in particular. First consultation with, see how with commercial chains it's often a coordinator, that's a salesperson. With the others, it's the actual surgeon. That one difference tells you everything about whether you're in a sales pitch or a medical consultation, and that really gets to the heart of it, doesn't it? A free consultation sounds great, but it creates this immense pressure to sell you a procedure. On the other hand, when you pay for a consultation, you're paying for a surgeon's time, their expertise, and their honest professional opinion, even if that opinion is that you shouldn't have surgery. The whole dynamic is different. Okay, so now that we know the landscape, let's build what I like to call your quality compass. These are the real objective markers you can use to figure out who is genuinely focused on quality and safety. And don't worry, we've boiled it all down to just 8 key markers. Yeah, forget all the glossy brochures and the fancy websites. These are the verifiable signs that actually matter, the ones that cut straight through the marketing fluff. Alright, listen up, because if you take away only one thing from this whole explainer, let it be this: the GMC Specialist Register for Plastic Surgery. Now, it's easy to get confused. Lots of doctors are GMC registered, but being on the Specialist Register for Plastic Surgery is the only official verifiable proof that they've done over 6 years of dedicated training. This is your number one non-negotiable check, okay? And here they are all together. This is your full checklist. It really covers 3 big areas. First, the surgeon's official qualifications, like that specialist register. Second, the whole consultation experience. Are you meeting the surgeon? Is it paid? Is there any pressure? And third, transparency. Things like reviews on open platforms like Google and a really clear aftercare plan. This is your new evaluation framework. Right, just as important as knowing what to look for is knowing what to look out for. So let's talk about the common red flags, the things that should make you pause and think twice. You've seen this, I'm sure, plastered all over a clinic's website. Winner, Best Clinic Award. But what does that actually mean? So what's the deal with these awards? Well, the truth is a lot of them are just bought. They're marketing tools. And you know what's crazy? We've seen award-winning surgeons who aren't even on that specialist register we just talked about. That's why you have to check the facts, not the trophy case. And then there's this one, get breast augmentation for only £98 a month. It makes it sound so easy, so accessible, doesn't it? But that's the problem. This isn't like buying a new sofa on finance. This is major surgery. When a clinic leads with a price like this, it trivializes the whole process. It's a huge red flag that they're prioritizing sales over your careful, calm, and informed decision. Okay, so we've covered a lot, the good, the bad, and the misleading. So how do you actually put all this into practice? Let's walk through a simple 5-step action plan To guide you, this 5-step framework gives you a clear path. You start by building a shortlist using those 8 quality markers then, and this is really important. You meet at least 2 different surgeons to compare their advice, and probably the most crucial step, take your time. Any good surgeon will encourage you to reflect. They'll never pressure you to book on the spot. So what's the big takeaway here? After everything we've covered, what's the one tool that ties this all together and puts the power back in your hands? It's this checklist right here. Think of it as your secret weapon. Print it out, take it with you to every consultation and ask these questions. Use it to cut through all the sales noise, because at the end of the day, finding the right provider isn't about finding the best one according to some paid award. It's about finding the one that proves with verifiable facts that they are the absolute best and safest choice for you.